Okay, well, welcome everyone to the NOURISH, or Nutrition for Our Immune System Health Autoimmunity Challenge webinar. It's really a pleasure to have you all join us today. I'm going to give you just a few housekeeping matters. This meeting is being recorded. We will share the recording on the NOURISH website, which we will drop in the Q&A for you to see. And the recording and slides will be posted on that NOURISH website. If any of you have technical issues, please send a message in the Q&A and our team will help you. The Q&A is open for your use, so feel free to type questions into that section. If you have logistical questions, we will try and answer them and help out as best we can. Please do remember that the Q&A is open, so be considerate and respectful and collaborative with your fellow participants. And at the end of the session, our participants will do some of the questions live as a kind of hands-on response to the Q&A. And again, thank you for joining us today. I'm going to start with a couple of introductions for our group. And after introductions, we will go ahead and call each other by first name just for the ease of this webinar. My name is Dr. Victoria Shamagam. I'm the Director of the Office of Autoimmune Disease Research at the NIH. We are an Office of the Director office, and we sit in the Office of Research on Women's Health. And it's really our pleasure to host this NOURISH Autoimmunity Challenge. On my team, we have Dr. Shinrei Lee, who is one of our program officers, and Dr. Carmen Ufret-Vincenti, who is another program officer on the team and is joining us here today. Carmen, I don't know if you want to say a quick hello.
Hi, everyone. I'll be working with you through the questions later after the presentation. Nice to meet you all.
And then I'm going to pass over to Dr. Laura Stelling from NASA, who runs the NASA Tournament Lab and is the advisor to this challenge.
Hi, everyone. I'm Laura Stelling. I am the Open Innovation Advisor for this project. I'm very excited to be a part of it, but they are utilizing the NASA Open Innovation Services contract for this. And so Ensemble is one of our partners on that, and they were awarded this challenge. So with that, I'll pass it over to Oliver.
Hey, everyone, and welcome to this webinar. Again, thank you so much for taking the time to learn about this important challenge. My name is Oliver Gerland. I help run Ensemble, and we specialize in working with the federal government to design and launch prize challenges. I'm accompanied by my colleague, Julia. Julia, if you want to intro yourself.
Sure. Thanks, Ollie. Hi, everyone. I'm Julia Carlson. I'm with Ensemble, and I'm helping to support this challenge. I'll be helping to support the Q&A and any technical issues that might arise today. So happy to be here and excited to have everyone here. And I will pass it back over to Vicky to kick us off with introduction.
Great, thanks, Julia. And it's really a pleasure to have this team supporting this challenge. So I wanted to give everyone a little bit of background into the Office of Autoimmune Disease Research and the reason why we've decided to run this challenge for this specific area of autoimmune disease research. The office is a relatively new office at the National Institutes of Health. It was established in early 2023 with a directive from Congress to form this office in the Office of Research on Women's Health, aligned with some content from the 2022 National Academies of Sciences, Engineering and Medicine report. This link will take you to the report if you would like to take a read. But essentially, that Consolidated Appropriations Act directed the office to coordinate the development of an NIH-wide strategic plan for autoimmune disease research, to identify areas of innovation and research opportunity, to coordinate and foster collaborative research across the institutes and centers at the NIH, to evaluate the portfolio of research across the NIH, to provide resources to support planning, collaboration, and innovation, and to develop a repository for autoimmune disease research. So that kind of is the background to the office. When the office was formed, we used this list of autoimmune diseases to kind of form the basis of the autoimmune disease research portfolio. I would urge you to take a look at this list as you're putting together your applications. There is a large print version available on our website if you would like to take a deeper dive into that portfolio. But it is extremely broad, and we do have really something in every body system, many autoimmune diseases on this list in our portfolio. So in terms of scope, autoimmune diseases are some of the most common chronic diseases in the United States. This graph just gives you a kind of broad overview of prevalence in the community. And this is looking at data pulled from a number of different sources, but it's estimated that the total number of people alive in the United States with autoimmune diseases is probably close to 50 million people. That kind of compares to coronary artery disease and chronic obstructive pulmonary disease at around 16 to 17 million people, Alzheimer's disease, which is about 6.7 million, HIV affects 1.2 million Americans, and then obviously the different cancers are much rarer, but still significant problem. But as you can see, autoimmune diseases are together one of the most chronic diseases in the United States, and something that the NIH is very keen to focus on. One of the challenges that we face when we're studying autoimmune diseases is that we have recognized for some time they have a fairly prolonged prodrome where individuals perhaps go from a more balanced immunity to a period of asymptomatic autoimmunity, often manifested by antibody production and evidence of immune activation, and then into the symptomatic period before clinical disease really becomes apparent. And we know that while genetics play a part in that, they don't explain the whole story. And certainly the rates of increase of autoimmune diseases in the population over the last 20, 30 years far exceeds that could be explained by genetics alone, which tells us that there must be other factors. We've kind of grouped those together under this term, the exposome, but that includes the many different exposures across our lifespan that can impact the immune system and how the immune system reacts. One of those is diet and nutrition and the things that we eat, and that is something that we're keen to focus on in this challenge. So if you'd like to read a little bit more about the NIH-wide strategic plan for autoimmune disease research, there is a link here on this slide, and these QR codes will take you to the website, where there is also a video cast of the launch video, including some opening remarks from the new NIH director, Dr. Jay Bhattacharya. I would urge you to take a look at that as you develop your materials for the challenge. Just to give you a summary, this is the overview of the strategic priorities and objectives of that strategic plan. And really this challenge falls under priority 5 of us really wanting to engage with people living with autoimmune diseases, patient advocacy groups, caregivers, partner with people and communities disproportionately affected by autoimmune disease outcomes in order to really foster this collaborative research environment. One of the things that we received in terms of input as we were developing that strategic plan was responses to a request for input from the community, which was issued back in December of 2023. There is a summary of this RFI responses on our website, which you can download and take a read. But I've pulled out a few quotes from those responses that really pertain to why running a challenge focused on diet and nutrition in autoimmunity makes sense. So one respondent said, research to understand the role of the collective and combined effects of multiple exposures in the environment that make people susceptible to autoimmune diseases, including food, environment, exposures through the lung and skin. Another said, I would love to see some collaboration with physical and occupational therapists, medical nutritionists, and dietitians, as well as residential and inpatient health facilities. Another mentioned that they wanted to see the NIH study factors that intersect and overlap, for instance, the role that diet may play in autoimmune disease, particularly in those genetically predisposed. And another respondent said, basic science and epidemiologic research to understand and identify environmental factors such as the microbiome and diet, as well as infectious triggers on the development of disease. So that input was obviously incorporated into our strategic plan. We also took some input from a NIH workshop that was hosted in August of 2024, and some of you may have attended this workshop. If you missed it and would like to learn more, there is a video cast still available online, and the QR code here will take you there. But it was really focused on the impact of food and diet on the development of host immune response, and particularly immune disorders. And it identified a number of gaps that there was an unmet need for research to identify and connect the scientific studies with the lived patient experience, and that there was a need to galvanize collaborative teams equipped to incorporate patient-focused outcomes into state-of-the-art research on diet and nutrition in autoimmune diseases. There is a summary of the workshop available also on this link at the bottom. And I would again urge people to take a look at that, because it will probably help you frame your submissions to this challenge. And we are really hoping that you'll be able to put together some good ideas for us in response to this need. So the goals of this NOURISH Autoimmunity Challenge are really to develop a cadre of innovative ideas to engage with our interdisciplinary problem solver communities, and to problem solve with you on how to best integrate diet and nutrition studies into autoimmune disease research. We're hoping that we'll be able to identify dietary and nutritional interventions that people would like to see tested scientifically. We're looking for ideas that are feasible, scalable, and have the potential to be transformative for autoimmune disease research. And we're also looking for ideas that will have a far-reaching impact across this very broad autoimmune disease portfolio. So who can enter the Autoimmunity Challenge? Good news is that the NOURISH Autoimmunity Challenge is open to everyone, and we really believe that science belongs to everyone. So we're looking for people to partner across all of these different groups: people living with and at risk for autoimmune disease, the various advocacy groups who work in this space, caregivers, parents, organizations looking after people with autoimmune disease, scientists, healthcare professionals, and dietitians and nutritionists. There are hopefully 15 prizes of $10,000 each that we hope to issue, so a total prize purse of $150,000. And we are really excited to see the ideas coming in from all of you. So how do you submit to the NOURISH Autoimmunity Challenge? I've given you a step-by-step guide here, and we're going to take you through this a couple of times. But step one is to go to the challenge.gov website. The first step is you have to create a account for that website and a login. You then go to the search bar and you can find the NOURISH Autoimmunity Challenge. Take a look at the instructions there, and we'll show you a few screenshots of this in a second. There is then a challenge registration form that you need to fill out, and I will walk you through that. We then advise you to go build your team, really brainstorm and collaborate about your ideas. We'll talk about the submission narrative and what needs to go into that. And then you upload your whole submission package into the challenge.gov website, and we will be able to see it there. So I'm going to walk you through the different steps in this, because I know that these various websites are not super intuitive, and you can refer back to this video as you need to. So if you would like to go to the challenge website, this link and QR code will take you there. Once you get there, as I mentioned, you have to register both for the website, the challenge.gov website, and for the actual challenge before you can submit. So to register for the actual challenge, the steps you have to take is go to the How to Enter tab at the top of that screen. I've circled it here in blue. And then if you look down to the challenge registration form circled here, you can click on that link and it will open a Microsoft form. And you are required to fill out that form before we can accept your application. You should fill out that form with all of the participants in your team, but we do recommend that you have one lead participant who does this form submission for you so that there isn't duplication. But it is important that you have formed your team and that you know all the members of your team before you fill out these forms. So next, I'm going to walk you through the actual submission narrative, and this has 5 components. We've outlined them here, and this outline is really what people should use as they're putting together their narrative. There are 5 components of it, and if you look on the right-hand side of the screen here, there are a few typesetting pieces of advice and requirements for the submission narrative. But the important things to include in your narrative are the scope of your idea and the scientific rationale for your idea. And what we're looking for is an explanation of your idea, including the proposed dietary and nutritional intervention and the background that supports that intervention. We're looking for information on the scientific rationale of your proposed intervention, as well as the measured autoimmune or immune system outcomes that you think should be measured. We want you to describe those and give us the rigorous outcome measures that you really would recommend looking at. Under the description of the team, we think it's very important that you let us know who your team members are. So it should include both the submitting individual and then the team and entity behind that. You can submit as an individual, but we do urge people to partner across the community if it's appropriate. We want to hear about the engagement and interdisciplinary expertise of your team, as well as perspectives from people with lived experience of autoimmune diseases, including the patient advocacy groups, people living with the disease, people at risk of the disease, scientists and physicians, and other allied health professionals. Under potential impact, we'd really like to hear what you think the impact of your proposed idea could have on autoimmune disease outcomes could be. And so we urge you to kind of think about that quite broadly. We'd like to hear about the feasibility of your idea. How is your idea going to advance autoimmune disease research, and how could it be scaled to the broader autoimmune disease populations? And then we'd like to hear about the innovation of your idea, particularly the novelty of the idea and how you see it fitting in with the current autoimmune disease landscape. So in terms of how to submit, and this is a little tricky, so I'm going to walk you through it and then we'll do a kind of hands-on show and tell with Oliver in a second. But when you get to the NIH Challenge website, you want to go to this orange Apply for this Challenge button. I've circled it here in blue. When I first looked at this website, I completely missed the orange button and couldn't see it. So it is right at the top in the banner there. You will then be asked to create the account and log in if you've not done it already. The login is linked to the login.gov. So if you've previously applied to a challenge, you'll already have a login for this site and you can reuse that same login. If you've never applied for a challenge before, you may need to create a new one. And once you've done that, you will be able to submit all of the parts of your submission package. You need to enter a title for the submission. We recommend you give a very brief description of your idea, and if possible, that should be in lay language so that it could be publicly available after the challenge. We'd like you to then upload your submission. You can leave the description field just with the quoted piece of text here. So just see uploaded files, an external URL if appropriate. And then to load the file for submission, you need to drag your file into that link or go to your folder and choose from the folder. You do need to rename the file, and Oliver's going to take you through the naming convention for that. And then you need to check the box that acknowledges that you've read the rules and you've conformed to the rules of the challenge, and then click the submit button. Again, I'm going to remind you, it is essential that you also complete the Microsoft form to register for the challenge with your team, and the two pieces should dovetail, so you need to have the same title and the same members in both documents. In terms of judging criteria, again, we have 5 criteria by which the challenge submissions will be evaluated by a panel of judges. Each of these criterion will be weighted equally, but we will be evaluating the submissions on how clearly the submission has described the idea and the proposed dietary or nutritional intervention and the background to support that intervention. In particular, we're looking to see, does the submission clearly describe the autoimmune disease outcomes or immune measures that should be evaluated? We want to see that there has been engagement, and so we are looking for how well the submission describes interdisciplinary expertise and expertise that was sought out in this ideation process. We want to hear how the idea could have impact across the broad autoimmune disease research community, and is it scientifically and strategically sound in its approach. We want to hear about feasibility. Could it be potentially developed into a feasible research program and scaled to broader autoimmune disease research populations? And then we want to hear about the innovation. So how novel and innovative is this proposed idea, and how will it advance autoimmune disease research and have broad applicability across the population? As I mentioned, the submitted ideas will be evaluated by a panel of judges, and each of these 5 criterion will be weighted equally. There are a few rules associated with this challenge, and so I do urge you to take a look at those. These are the eligibility criteria, and they are required. We cannot be flexible on this, so it is essential that you've registered to participate in the challenge. You must comply with the rules and regulations in the challenge, and so I urge you to read those very carefully. In particular, it is essential that participants and applicants for this challenge are US-based, and so please be sure to take a look at those rules and make sure you follow them. The challenge cannot accept submissions from a federal entity or federal employees acting within the scope of their employment. They cannot be employees of HHS or any other component of HHS, and they obviously cannot be judges of the challenge. So if you have questions on any of those rules, feel free to ask them, but those should be fairly straightforward. So important dates to note for this challenge. We are open for submissions now. So if you're really quick, you could get your submission in today if you wished. But I urge you to really take the time to put together a good response to this challenge competition. And that really does involve partnering across the community. This is the first webinar for the challenge. We are hoping to have a second webinar sometime in October, and we will keep you posted about the dates of that. The challenge will close to submissions in December, so December 4th, 2025. Again, that is a hard close date, so make sure you don't miss that deadline. The judging period will be January to February, and we're planning to announce the winners in conjunction with the Autoimmune Disease Awareness Month in March of 2026. So there will be reminders for all of these. If you log in and register your interest for the challenge, you will get some of these reminders. So now I am going to stop sharing my screen and hand the microphone over to Oliver Gerland from Ensemble, who will give us an at-the-elbow demonstration of how this works. Oliver.
Great, thank you so much. So I just wanted to begin, and maybe Julia, if you could drop some of these links into the chat. But just to call out the kind of primary destination for this challenge, one of the first places to start is nourishchallenge.org. That is the challenge informational website that really details the core components of the challenge, but importantly, this is one of the places you can find the registration link for the Microsoft form. So if you are interested in joining, I encourage you to come to nourishchallenge.org, take a look at the website and the key dates. Certainly December 4th is a really important date to keep in mind for your submission. We will also be posting a recording of this webinar as well as the slides here sometime this week. And with that, I will jump into the actual process for registering and then show you what it looks like in challenge.gov. So just to begin, I'm interested in registering for the challenge. I'll click register and a Microsoft form will pop up. This is the standard eligibility requirements language that we just discussed. Just to get ahead of one question I saw already regarding if non-citizens can participate. So the participants must be, or the lead participant must be a citizen or permanent resident if they are a participant. But if there is a team or group of individuals, a non-US citizen can participate in the team. But the registering individual must be a citizen or permanent. So to answer that question, yes. So I will walk through this process. The first question is, do you intend to use federal funds from grant, award, or cooperative agreement to develop your submission? I'm going to click no. I'm going to register for myself as an individual. I'll click individual and hit next. And then I'm just going to enter my details. So on and so forth. And with that, I will enter my zip code, country, all of that good stuff, and the affiliation, which is optional, and submit. So we also ask that you certify that you've read and understand the official eligibility rules and criteria here at this point. Then click submit, and then you are basically good to begin working on your idea. And when your idea is actually ready for submission, you'll come back to the challenge.gov site. But first, let me just show you, you can also find that link on the nourishchallenge.org website. So I've now developed my solution. I've registered. I've come back to nourishchallenge.org. Now I'm going to jump to submit your entry, which will be here, and we'll add more buttons within that. And now I have arrived at the challenge.gov page. Just to, walk you through it, I've already signed in. I have an account. Everyone who submits will need an account on challenge.gov. And this is managed by the login.gov technology. So if you have a login.gov account, that should work for your challenge.gov account. And especially if you've already submitted to prior challenges, that also will work. So I've landed on challenge.gov. I'm going to scroll down and find the Nourish challenge. Click on this. As mentioned, I'll click apply for this challenge. It must have signed me out, so I'm just going to sign back in. Okay, so now I've arrived at the submission form. And as we discussed, you can see the title, a brief description. So you only have 5 characters. And then in this description, you can just say refer to uploaded file. So of course, add your title, a brief description, and then refer to PDF upload. Again, you can drag and drop or choose from your folder. And then for the file name, we would ask that you save the file name with your team name. So in this case, maybe my team name is Team Ensemble, and then underscore Nourish Challenge entry. So ensemble underscore Nourish Challenge entry would be my file name. And with that, you can attach your file. And then we also, as an optional, you can add a URL for more information. about your organization or about your approach. Again, certify that you've read the rules and conditions. You also can save a draft. So I'll just go ahead and save a draft here, and then you can jump back into the submission at any time, and then you can submit when the time is right. So that is the overall process for applying to the challenge. Just again, and we will drop these links if we haven't already. nourishchallenge.org is a great first destination. Challenge.gov is where you'll find all of the in-depth information about the challenge, including the rules. You can print the rules right here. So if you hit print challenge, and that button is also available, and that will load a printable document, which I know some people like, and complete your registration form, and then submit by the due date, which is December 4th. So with that, I will pass it back over to Victoria, and we can keep going. So hopefully that was straightforward, and the process is a low lift. So yeah, again, thank you so much for your interest in this competition.
Thank you, Oliver. That was fabulous. And I'm now gonna open it up for the Q&A, and hopefully Carmen can come on screen and moderate some of these questions. And
hi, everyone. And as a reminder, I am Carmen Uflet-Vincenti. I am a program officer at the Office of Autoimmune Disease Research. Julia and I are going to tag team with the Q&A, and let's get started. The first one is very easy. Vicky, are we able to get slides at the end of this presentation?
Yes, absolutely. So if you go to the nourishchallenge.org website, both the actual presentation recording and then also the slides from the recording will be uploaded later on this week, as soon as we've done the post-production for those, and you'll be able to download them from there.
Great. There are two questions that are related, so I'll ask them at the same time. The first part of the question is, I would like to know how the panel of judges will be selected and whether it will be internal or external to NIH. And the second part of that question is, I am a federal government employee and interested in serving as a judge. How can I apply?
Thank you for that question. We are broadly looking for judges from across the NIH and HHS. So if you're a federal employee at HHS or the NIH, please feel free to shoot us an email. And we will be selecting those judges in December time. And the judging will happen between January and February of 2026. So if you are available and are a federal employee working for either the NIH or HHS, would like to volunteer, we'll be happy to have your assistance.
Great, thank you, Vicky. There are two questions that are related to citizenship. Since we touched a little bit on that, I'm going to jump to the next ones and come back to that at the end. What happens to the ideas submitted? Is it for awareness or is it to guide future research?
So you're correct. At the moment, we're just looking for ideas, and there will be a future webinar held in March of 2026 where we will share with the community who the winners of the challenge are. So you will be sharing your ideas with the community. We hope that they will be informing future research for autoimmune disease research, both NIH funded research and other organizations that support autoimmune disease research. We are looking for ways to galvanize this field. Of course, if you have brilliant ideas and want to subsequently submit through one of the open NIH parent award mechanisms for funding for your research project, we would strongly encourage that if you have really well formulated ideas. So we're really looking to kind of stimulate research in this field, but for the challenge itself, it's just an ideation challenge. So we're looking for people's good ideas about what could potentially be done in this space.
Great. And will the award be awarded to the organization or individual?
So I might ask Oliver to assist with this one because I want to make sure I answer this correctly. The award is awarded to the team that submits, and how that is distributed is really up to the team who is winning the award. Oliver, if you can add more.
Yes. So as we showed in the participant registration, the first thing that you're going to register, you're either registering as an individual or as a team, right? So if you register as an individual and you win the prize, then the award would be to that individual. But if you register as a team or organization, then that would be awarded to the organization. So really, it's just a question of how do you register and submit, but we would not be awarding this to an individual within the organization. The organization would be getting it. And of course, if it's just an individual, that individual would be awarded.
So, Oliver, if you since you're on camera, I'm going to ask another one that is for you. What are the most common mistakes or omissions seen in past challenge submissions, and how can applicants ensure their application meets all criteria for review?
Yeah, that's another really great question and really important too. I would say one of the most important things or gaps is that sometimes these ideas or submission narratives are not aligned with the actual submission requirements. So again, if you go on challenge.gov or nourish.org, you'll see the 5 narrative elements: scope of idea, team description, potential impact, feasibility, and idea innovation. Your narrative should be structured to hit those items. So for example, if you're missed out on feasibility, then that would be an issue. And so sometimes we see submissions that aren't aligned or relevant to the actual narrative content. So just similarly to a proposal, you need to make it aligned and relevant. And another thing we've seen is that lots of smart people want to promote their own research, which is wonderful, but the solution needs to be tailored and specific to the nature of this problem. So just regurgitating your research in a way that's not relevant to this project, that also would be an issue, and you likely would not get awarded. So stick to the narrative elements and make sure that the solution is relevant, basically. Yeah.
Thank you, Oliver. I think this one is going to be for Vicky. Can the proposal be a preclinical animal research idea?
So we are really looking for ideas that will impact human health. So this may not be the best venue for a pure animal model or animal-based research idea. We are truly looking for ideas that will more broadly impact human health. If your idea does link to human health and you articulate that well, then you're very welcome to submit it. I just would urge people to think about how their ideas are going to have impact to the broader human health of autoimmune disease research.
And another approach-related question, is an intervention required, or can the idea be a purely observational study?
I actually think that there is so much that we don't know about the intersection of diet and nutrition with autoimmune disease research. I would imagine that observational studies and concepts related to observational studies would be very well received. There certainly does not need to be a specific dietary intervention. And I think one of the things, the big unknowns is over the course of our lifespans, we know there are dietary factors that play into how the immune system responds, and we really don't know how to study those well. So I think we're open to all ideas, and observational studies would fall into that.
And yet another approach question. We have really good questions. Thank you, everybody, for these ideas. Can we use research platforms such as All of Us to form the foundation of our proposal?
we would certainly be enthusiastic to see people collaborating broadly across existing resources. All of Us is one. There's many other publicly available resources, including Import and a number of other NIH-sponsored resources. But I would also urge you to look broadly. I know that a lot of foundations have their own disease-specific repositories and registries, and I would kind of urge you to think broadly across the diseases areas that you're interested in, or more generally about autoimmune disease research, and how could you study the intersection of diet and nutrition with autoimmune disease in the broadest sense.
So the ideas can be proposal of clinical trial evaluation of nutrition in autoimmune diseases.
So yes, I would urge people that this is the idea, right? So it's an ideation challenge. You do not have to submit an entire research proposal. What we're looking for and wanting to crowdsource all of you for is how could this be integrated? How could this be studied in the longer term? And I think that approaches could take many different forms. And we're really looking for people to think broadly and think innovatively about how could this be done in a kind of very open way. That might take the format of clinical trials. It might take the format of observational studies. It very may well take the format of using existing repositories and resources that are out in the community. We're really looking for good ideas on how this could be done, and excited to have all these amazing questions, because it tells us that you're already thinking about this.
So does this have to be broadly autoimmune, or can it be individual disease disorder related?
It could very well focus over just a single disease, or more broadly across different autoimmune diseases. There are also, I will highlight, a number of autoimmune diseases that do commonly co-occur together. And so, you know, I wouldn't hesitate to do a little bit of background reading and see where there could be intersection or overlap or areas of shared interest across different groups. You can certainly take a look at the NIH-wide strategic plan for autoimmune disease research, and there's a good amount of information in there about how what our current understanding is of how autoimmune diseases develop and progress. But I think we are really looking for ideas that will have scalability and that will have impact across the autoimmune disease community.
That's wonderful. I'm going to read a couple of questions together because they address the nature of the challenge when compared to what a scientific grant would be. So I think I'm going to combine 3 or 4 questions, and then you can answer them all together. So what is the time period within which the award needs to be used once confirmed in March 2026? Will there be any opportunities for funding to actually implement ideas for the 15 ideas that do win? What items can be included in the budget? I think those are the 3 that I can combine. I thought it was 4, but 3.
Oliver, do you want to start that one
Yeah,
off?
I'll start, and then I will pass it over to you. But really, I want to communicate as clearly as possible. This prize has no future obligations. If you win a prize, it's because you already submitted a innovative concept or narrative paper. So let's say I win the prize. I get one $10,000 prize. There's 15 prizes equal to $10,000. I have no I don't need to spend that money in any. I could go to Hawaii if I wanted, because I've already won the prize in the past. Now, of course, we're hoping that this stimulates activity, but there is no commitment. There is, and the question about the budget, we're not asking for a budget. That's not part of the submission requirement. So that's maybe an example of like where a submission could go wrong, is if it listed a budget, that might confuse our judges because we're not asking for a budget. We are looking for great ideas. Your idea is what's worth $10,000. So regarding future opportunities, I can pass that over to Victoria. But just to clearly state, this is a prize for something that you've done by submitting your idea. It's not a grant. You don't need to spend the money. You don't need to show us how you spend the money. All of that thing, all of those opportunities are, potentially in the future, but that is not in the scope of this prize competition. Victoria?
Yeah, and then I would say, part of this is that the process is part of the journey with this, and we are really looking to help stimulate this area of research and galvanize this area of research. So I would imagine that through the discussions you have as you form your teams and as you formulate your ideas and come up with good ideas, and you may have more than one, that you will think about new approaches, new ways to study autoimmune diseases and incorporate nutrition and diet into those studies. And as you do that, you can take those ideas and submit them through existing funding opportunities through NIH mechanisms. And we hope that you do. So the kind of purpose of this challenge is really to start getting people working together across these different groups that have interest in autoimmune diseases and get people talking. There are some prizes on offer, and so hopefully that's a good reason to participate. But we also know that some of this is just having those conversations, being in those rooms, dare I say it, breaking bread together to be able to form teams and start to think about how this research could be done. And then we would fully anticipate that some of you will have very productive collaborations and go on to submit full research proposals around your area of interest. And we would truly applaud that. That is part of what we're looking for, but you would win the prize just for the idea.
Wonderful. Kind of related, but a little bit different, right? How will NIH use this information?
So the Office of Autoimmune Disease is very keen to hear about what people think should be done in this particular area and related to both studying diet and nutrition in human health and particularly in autoimmune disease research. And so do know that we always read deeply pretty much everything that is submitted through our office and to initiatives that we're running. And that very may well inform future opportunities that we're able to put together. But we also would say, even right now, there are existing funding opportunities through parent award mechanisms that may be good fits for your research. And so part of this process is by stimulating this collaboration across teams of researchers, you may be ready and poised already to submit other research ideas. So we're really excited to hear what people come up with and to see this challenge competition stimulate research in this area.
So I have two questions related to registration. The first one, if I work for an organization but will be submitting the application based on me, should I still register as an organization or individual?
Sure, I can address this. So you should ask who is kind of leading the team. So if you are representing your organization, you should be registering as an organization and applying. If this is kind of another different, separate from your kind of responsibilities from your organization, and if you are not representing your organization with this idea, then I would recommend you register as an individual and it be part of, the individual category of that type of participant. So again, it's really to your best determination of who is representing the solution. Are you representing the organization who is proposing the solution or kind of the idea, or is that, again, an individual thing? So really, it's up to your best judgment on how you submit and register.
And this one is also for you, Oliver. I registered as an individual, but have now decided to collaborate with others. Do I need to resubmit a new registration form as a team? Will there be any issues with duplicating fields from my original form?
Yeah, great question. So let's say you do want to collaborate with a broader team, but you've already registered as an individual. We would just ask you to re-register again and register as a team. So we will kind of back check all of these when we are reviewing the submissions. So it won't be any problem if you registered first as an individual and then registered again as a team. We will be tracking that and no problems at all on that.
Also for you, Oliver, are there examples that are available of successful submissions?
So not specific to this challenge, right? Because this is a novel crowdsourcing initiative. There are other challenge.gov, successful challenges. So I would recommend taking a look at challenge.gov and taking a look at some of the prior winners on challenge.gov, particularly with HHS challenges. But I do want to call out that the nature of challenges is always unique. There's a unique challenge that we're always trying to solve. So it is not as easy as just looking at prior examples. I would say as long as you're compliant, we still want to see that creativity and feasibility, originality, because that's what this is all about, is sourcing new novel ideas that we can assess. But yeah, I would recommend taking a look at challenge.gov, and you can take a look at some of the submissions and the winners there to get a sense. But yeah, it's really just a high quality narrative paper that's 6 pages that hits these requirements. That's what we're looking for.
Does the winner receive the full prize, or is the 150,000 broken between the multiple winners?
Yeah, so there's 15 prizes. So each winner receives the same prize amount, $10,000. 10,000 times 15, that's the full prize purse. But again, you will receive $10,000 if you win.
Okay, and I have two more questions related to approach. So those are for Vicky. How ambitious can the idea be? And in thinking about feasibility, is the time it would take to get results if the idea were to be implemented going to be part of it?
So we're looking for broad impact. So big ideas are definitely of interest to us, but we do want things that are feasible and scalable. And so just really think about those concepts and those judging criteria as you put together your applications, and how could your idea really fit into those criteria.
And then 3 people ask about non-citizen members of the team. So perhaps we can remind the group about the rules related to that.
Yeah, so I want to just point directly at the language that we use on the participant registration form because this is important to call out. Because there is basically I would say 2 parts to the answer. So yes, individuals who are non-US citizens and non-permanent residents can participate as a member of the team, if the team otherwise satisfies the eligibility criteria. So, if your team is composed mostly of US citizens or permanent residents, and there's, 1 or 2 non-US citizens or non-permanent residents, they can participate. The element that we have to call out is that non-US citizens and non-permanent residents are not eligible to win a monetary prize in whole or in part. So you're able to participate, but we are unable to provide prizes to you. We would flow the prize to the team leader or the organization.
Great. Then what are the criteria that will be used to assess each idea?
Yeah, so again, I would recommend going on to challenge.gov and Nourish Challenge. I'll pass it over to Victoria, but these questions are good questions. And we highly recommend that you read the rules document and read the challenge.gov because that is where you'll be able to find the in-depth answer, but I'll pass it over to Victoria.
Yeah, I was going to kind of say the same thing, that it definitely look back at those judging criteria, because that's really the rubric. It's both listed on the challenge.gov site. I believe it's listed on our nourishchallenge.org site, and then it's also in the slides that we just went through, and we'll be posting those slides for you to look at.
And will applicants receive feedback from reviewers on the ideas?
Sadly, I am not going to be able to achieve that. But you can rest assured that we will read everyone's ideas, and that we are learning all the time. And so you can rest assured that we will be looking at everyone's ideas. There will be a webinar in March of 2026 when we will announce the winners and let people know about the winning ideas, which I think is also informative for the broader community. And so we will obviously be posting information about that a little bit nearer to the time.
Only 2 more questions left. For the person who asked about being a judge, who specifically should I email? So this is a good question to give the OEDR info email.
Yes, and I think perhaps it's on my next slide, but we have a website called oadrinfo at nih.gov. Carmen, correct me if I'm wrong with that email.
So no, that's the email, oadrinfo at nih.gov.
And if you are interested, then please send your info there. And again, we man that, so we will get back to you. I guess what was the last question?
And the last question is, again, this is a good time to remind them, the webinar and the slides are going to be posted on a website. So I left it to the end because it's a good reminder.
So I actually just flipped over to that slide. So our website for the Nourish Challenge is now live. Please bookmark it and go there often. We will be updating that website, both with the slides and the recording from today. And then also when we have our October webinar scheduled, we'll post an update there. There's a lot of information there already, along with the email contact information. So feel free to go there for updates. I do want to flag a couple things coming up that you're welcome to register for if you are interested in autoimmune disease. We do host an updates on the Office of Autoimmune Disease Research. We are just getting this started again after a bit of a pause in communications. We're hoping to host it on November 14th, and it typically runs at noon. It is live only, so we do not record this. You do have to join live if you want to listen in. It is a great opportunity to both hear about what's going on in the life of the office, and then also what's going on in the life of other people's advocacy groups, people who are interested in autoimmune disease research. We let others provide input. So with that, I can see that it is 2:28. So I am going to thank everyone for your attention today. It's really been a pleasure sharing all of this information for you. We are very excited about this challenge. We are very excited about hearing all of your brilliant ideas in this space. If you do have further questions, then our email is oadrinfo@nih.gov. The OADR website is listed here too. And then if you have questions and want information about the challenge, the best place to look for that is the nourishchallenge.org website. Thank you for listening and have a great day.
Thanks so much, everyone.
Thank you, everyone. Bye.